Well, special guests Ansgar and Dale, you're here to teach us. We are here to learn. Please, please kick it off.
Okay, so I'm going to share my screen here. And share, and everybody should see the first, like the cover slide. Everybody see that? Okay,
Yep.
cool.
Loud and clear.
All right, so just real quick about who am I? So I'm Dale Gallaher. I'm the president of Cognition, but from the standpoint of what I primary responsibilities there, it's on the technical side of the company. I grew up in Western Pennsylvania and pretty much enjoy anything that's outdoor related, whether it's hiking, kayaking, hunting, all of those kinds of things. And I have climbed all 48 4,000-foot peaks in New Hampshire. So that's kind of one of my achievements that I'm really proud of outside of work. From a professional standpoint, I went to Bucknell University, got my bachelor's science degree in mechanical engineering. And after Bucknell, I worked at GE designing propulsion systems for ships and submarines, which was a lot different than medical devices for sure. And then while I was at GE, I went to MIT for my master's in mechanical engineering and then helped start Cognition, using a thesis that I did and a thesis another person at MIT did. And so since then, Cognition initially had a product that was an analysis product, and we had sold that off to another company way back in 2006. The current thing we're talking about today, we started way back in 2001. I wrote a prototype. We went to a show. Everybody liked it. It was for design for Six Sigma, and to help people that were getting trained on implement. I don't know, is anybody on this call had design for Six Sigma training? I don't think it's common now, but back then it was really big. And that's kind of why we wrote the product, because people needed something to kind of implement that methodology. And it really turns out to just be a rigorous design process that aligns really well with the design control process for medical devices. So that's why I think we've kind of worked our way into that area of medical devices being our primary focus for our product.
Dale, how many employees do you have now?
So we're just under 50 employees.
50?
Yeah.
I congratulate you. You're responsible for at least 50 livelihoods. I think that's fantastic.
Yeah. And we've been, we've been around for enough years that we've have a really good base, customer base with some of the larger med device companies. And, we're really trying to get into that medium-sized market, and you'll see kind of where that fits in here as we go through some of the slides we have here today. But that's pretty much kind of where I and Cognition is. And so I kind of want to get into why we're here and what we think the industry needs and why we're probably going to be able to help out there. All right, so on this slide, I'm going to let you guys look at the bullets a little bit, but I'm just going to tell you a brief story that I'm sure a lot of people on this call can relate to. So a customer came to us probably about 8 to 10 years ago that was a orthopedic implant design, medical device manufacturer, and they had started with some 483 warning letters, and the FDA came in and he found other problems, and it just grew and was spiraling out of control because they had a paper-based system. So everything was, in Word and Excel and printed in a huge room full of file cabinets, and that was their, design history file. And when they were making changes to these devices, they were really having trouble keeping track of, what was really impacted by the change and getting that right. And that was what was causing all of these warning letters. They decided, we can't do it this way anymore. We need a system where we put all of this data in and it keeps track of all of that connectivity, and we know what the impact of any of those changes are. And so that's kind of what this slide is getting at. It's like if you're doing a manual process, it's hard to stay, keep track of everything that's changing. I think some items can be in lots of different places. The change management becomes hard. The review process for anything, both new and everything, is hard. So everything gets simpler because a lot of the information is automated when one item is the same item everywhere you use it. And so that's really what our system is, designed to do, is to make it so if you have a requirement or you have a risk element or you have a test, all of those things, they're only going to show up. There's only one object that shows up in lots of places. So if you change it, it updates everywhere. So I'm curious around that story. I mean, I'm sure you guys on the call have experienced something similar where, you have somebody that's having these problems with their manual process and trying to get the automated process. Does that resonate with anybody here?
No,
So I do virtual quality management systems, and I do leverage the Excel logs and the Microsoft Words, but the thing about it is we've actually really thought it through, and I have been through at least in 15 years I've been through at least 4 FDA, at least 6 or 7 FDB, and I've had 0 problems. The clients I've had problems with legacy documents. So if you're 100% Bushman QC and you have the master index in, and you have the DHF, and you have the DCO logs, and you have established it, you don't have any of those paper problems that you're talking about. And that is to prevent that validation cost, right? Because a lot of your small startups don't have the validation cost. And then if you do have the extra funds, I always suggest you go into matrix requirements to do your tracing, because that creates a nice traceability from your user requirements to your design requirements to your risks to your validation. If you do that in parallel to a VQMS, you're usually pretty good. I mean, I literally had the FDB inspector, I'm not lying, say they're really lucky they put your system in because it saved them so they could get a license. And he's actually the 3rd time he's audited me. So we've kind of he's like, oh, I know you. And it was really kind of cool yesterday.
Sure. Yeah. And I think that, especially, for so the smaller companies that might only have one device and they don't have families of devices, I think you can definitely do a process like that and it can work out. So the question really comes, when does it become, a complex enough process, with enough information that it gets harder to maintain that manual way, and that's going to be different for everybody, because if they have a process like you said where you have a pretty good index of tying everything together, then you can keep things together. If it's less organized, then maybe it's sooner. So I think it really depends on when somebody gets to that point where they really need something that automates all of this connectivity and the production of the DHF content.
And then, Dale, another contributing factor is the legacy employee in the legacy location. And like you said, they have a file cabinet, but I can tell you, everybody I've ever seen with a paper system, it's always, well, hey, Joe has a portion of that on his desktop, and he's in, Baja until this time because he's the one who created the device, right? And so there's always, when you have that paper system, even though you have file cabinets, there's always somebody who has that record. And so it creates a problem.
Right. Yeah. And like who had the last one and who made the last change, that kind of problem. And document management systems can help that a little bit, I think, too.
Yep.
Gail, do you consider Greenlight Guru a competitor?
So to some extent, we don't typically run into them head to head as much, more because they really focus on that smaller medical device company where they're also providing the expertise of getting them started. So we don't run into them nearly as much as we might other competitors. I think that Greenlight Guru still has a thing in the mix, but I think when people, again, they get to that complexity where they really want a data-centric model with some of the functionality that we have, that's when we would see somebody maybe want to move to a product like ours.
Yeah, but I also, like many users on Greenlight Guru, say how complicated it is. Like the logs that I've designed them specifically with the concept of in 5 years, and 5 to 10 years, depending on when the company's ready. I've set my data to where one field has 1 point. So like I could meet with Dale, we could create, imports, and he could literally move our data in. And we should have the ability to move anywhere from 80 to 90% of the data into his system quite smoothly. Because a lot of people, when they're creating their logs, they'll say this column has 5 points. Well, with BQC, that column has 1 point, and that's it. And then that makes life easier.
Right. Yeah, and so we do have, like, when people are coming up into our product, they have the data that we'll import in and can kind of mirror it all into our data model.
Who do you consider to be your chief competitors?
The number one competitor that we run into is JAMA.
Is
JAMA software.
Huh.
They're more, they have certainly a market in the medical device, but they market themselves more as a general design tool. So they're in the other markets where we focus just in the medical device space. And because of that, we have some unique capabilities for the medical device part that JAMA doesn't have.
Dale, we have JAMA at the moment. Can you elaborate a little bit more where you stand out above JAMA?
Yeah, absolutely. So I believe the number one area that we stand out is our ability to produce your DHF documents in exactly the format that you want to match your quality management system. JAMA is very tabular centric as far as the way you put the data in. And once you get everything in, you have to work to get the format out you want. And that's what, we've heard from people that have migrated from JAMA to us. That's one of their biggest issues. Another big area is that we have a very deep risk management functionality. And if you guys have, I'm sure you've run into risk management people, everybody has a different way of doing it. And we have our product is very configurable to match those risk management processes. So the tying between the risk management and the requirements then is really tight in our system. And then I think the last piece is, our ability to configure generally the kind of what you want to see and so on in our product is definitely superior to JAMA. Those are probably the three big areas that we see the differences. Does that make sense? All right, so this next slide, I'm not going to spend any time talking about the data. The punchline here is that we did sponsor a survey last year to medical device companies, and 50% of them said they really aren't happy with their process. And only a third of them were really happy with their process. So there's definitely people out there that are looking to improve, and that's really what this slide's about. If you want to request the slide set at the end of after the webinar, the link here at the bottom will give you the access to the details of that.
maybe Ansgar or Ben or Gerald, you could put the link in the chat now for our guests.
For the report or for the slide set?
Both.
Yep. I'll let Ansgar figure that out because I don't actually have. I was going to send it afterwards. I don't have a link ready right now myself.
I don't have the link either, so I'm sorry.
We'll make sure we get it to everybody.
Thank you.
Okay, so this is our product is called Compass Med. I'm not going to read all of the details here, but really one of the big things for medical devices, it's a SaaS solution. It's pre-configured for you to design medical devices. If you don't have any opinions on exactly how you do your design process, you can use Compass as is out of the box, and you can get through your requirements test and your risk process. It does have, like I said, though, it has configurable options, so you can also tweak it to match places where you might have different opinions than what Compass provides. So that's probably the biggest thing for medical. This is like, if somebody wants to get started, they can just start it. They don't have to do a whole bunch of configuration effort up front. We do have, as part of that pre-configured environment, we have these off-shelf templates you get that will create your design inputs documents, your design output documents, your test documents, your master traces, and Ansgar will show you some of this in the quick demo we're going to do towards the end of the call here. And all of those are really available at the click of the button. You just click your PDF, you get it out. You can do all of the review and approval process inside Compass, or if you already have a EQMS where you're managing your documents, you can take that PDF over there and you can manage it over there. So you can do that either way. We also have a lot of functionality, so you can integrate those two things together well. So that's kind of the key part of Compass. It does the requirements, risk, and test management, ties everything together. So this is just a slide that'll show you how things are connected. So again, it's not document centric. The documents are the output you get out of this out of it. But the idea is that you really want the data-centric model, so you know every requirement, like what its parent requirements are and what its child requirements. So if you look, we have a design input here in the middle, and above it, the user need that it satisfies. And below it are, your lower level requirements that satisfy the design input. And then on the left side of this trace, you can see test documents that might be referring to that. So you have test protocols and test methods that it can be connected to. And then on the right side, you see the risk information that the requirement is connected to. You can navigate through this. So like if you pick, the user need, it'll put the user need in the center and show it. So it's kind of, you can just walk through the data model using this page. So this is the trace document that you get automatically after you build all of this. So one thing you do, and I think we're talking about the manual effort, if you do all of these requirements documents and you create all of these, sub requirements and parent requirements and so on, you still then have to go to an Excel document typically, and you'll manually put all these things in, and you need to make sure all of those connections are there so that you don't get anything wrong. And because everything's already connected in Compass, this just comes out automatically. There's no manual effort for whatever. In Ansgar, again, I'll show you a little bit of this during the demo portion of the call.
I will.
Go ahead.
No, I will. That's right.
So this automatic tracing functionality, we feel is one of the most significant reasons you would want to go from a more manual system into something like Compass Med. And hopefully that resonates with this group, I think, especially as it gets more complicated. But that's probably the most significant power you get, is you have all of that traceability and you don't make those mistakes when you make a change. It's everything that it's connected to.
Are you guys coming to 10X
Are we what?
in May? Are you guys coming to California in May?
We were going to talk about that after today's call. I wanted to introduce them to the group before.
Well, Ben and Ansgar know the group already, but sure. Okay.
Yeah.
Okay.
Yeah, I think I do remember mentioning something there, Sean, but I forgot about the details of it. All right. So this is a lot of information on the slide. We tried to highlight in blue, what the real key point was of all of these items. And, the left side is like who we think can benefit from this. And then the right side is, why do you want to use this approach versus, a manual method or maybe a document-centric application that you have. And, I talked about earlier about, if you're having a lot of FDA warnings because you don't have that traceability and you're having trouble maintaining it, I think that's a good reason. If you're having product recalls or product quality problems because you're missing that traceability and you're getting some of that design information wrong, we provide that traceability. One other thing that I'm not sure you'll see much in the demo, you'd see in a more detailed demo, but we have a lot of data reuse. So like if you have a family of products, you can have like a product that you have a library for this product, and then all the product families can derive from that. So when you make changes to common elements, all of the products in the family can pick up those changes. We also have like risk libraries, and you can have requirement standard libraries. So things like that you can reuse in all of your projects. We have a very rich risk management piece. You'll just get a very cursory look for that today with Ansgar. But again, we have a lot of details that would require a fairly longer demo than what we have today. Everything is tracked and audited, so whatever change you make on anything, you can go and see exactly who made it, when they made it, and that helps any kind of change management you might have. And then it helps you be compliant. And so we guide you through a way that we believe, and worked with, other regulatory people to make sure that we're providing you a compliant process that meets the standards. We've talked about the templates and the product lines, the central libraries. I think we've covered everything here, the last piece, as I talked about earlier, is you can just get all of your DHF documents, with the click of a button. Any questions here on these bullets? There's a lot of information on this slide.
Good to see the demo.
So I'm getting through these faster than I thought. So I think we might have more time for the demo on Ansgar, like if his questions come up.
Yeah, well, I expect people to ask questions while we go on here, right? So
right.
That's fine. We're not in a rush.
Right. This is just an ROI potential way you could calculate it for a given customer. This is going to vary depending on exactly what their process is before and what their process is after. But the whole point here is, like, if I have a lot of stuff that's connected together and I had to go through and do all of this manually and assess everything manually, it could be really expensive. And then but if you have everything already connected together, you already have a lot of those answers, and you change it in one place. Every place it uses is up to date. So this is in here mostly as a sample. I wasn't going to spend a lot of time talking on this, but hopefully the gist of it makes sense as far as how you would reduce this from your manual process going into something like a data-centric model. Any questions on this? All right, I'm going to go on to the next part here, which is I'm going to give it back to Ansgar so he can show you what it looks like.
Hey, Ansgar, excuse me,
Hello.
Jerry Wessel here. Just came by to say hi, everybody. I was chatting with Kristen, and she will put the link to the
Already have.
slides as well as the market survey study in the chat.
Already
So,
there, folks.
Perfect. In Italy. All right. enjoy the food and wine. Great. Thanks, Kristen.
Okay, so I took control. Can everybody see my screen?
Yep.
Okay, so I usually demos take a long time, especially when we go into a lot of detail. So I will not bore everybody on a Friday, what is it, lunchtime for you guys, and Friday evening for me, with all the nitty-gritty details. Although I'm a techie guy and I like this sort of stuff, right? So stop me if I'm getting too detailed. But the aim here for me is to show you, why Compass is a little different and how it actually works. What's the basics behind that, and hopefully that helps the gentleman who asked about JAMA earlier. I think Loic, is that the right name? Loic, I hope I pronounced that correctly.
No,
I think he was.
Yeah, it's a Dutch way of writing Luke.
Okay, Luke. Okay, Luke. I can hopefully remember that. So good to meet you, Luke.
Hi, Ansgar.
Great. So Compass is web-based. I'm here in Chrome, and just for general navigation or orientation, we have a couple of sort of navigation windows here on the left-hand side, and we have a main window on the right, and whatever you select here on the left will be displayed on the right. That is sort of the general introduction, and that is all I want to talk about here. You see there's nice graphs and pictures and all this sort of stuff. That is really something for a longer demo. But in terms of principle, let me go straight into the guts of this. I work with a lot of customers, and just to give you one example, I have a customer, they design CT scanners, and they have something like 100,000 requirements, probably more, and 60,000 tests and risk items. I don't even know how many they have. So that is for us a pretty typical project scale. It's not even a very large company or very large product, but they have product lines, different offshoots of the main product, and they all need to be managed. And their issue was that they have a lot of documentation, of course, and generating these documents was one thing. Of course, they can do it all in Word, but they needed to manage and literally micromanage all these different requirements and all the different connections that these requirements with the tests and the risks might have. And this is where we come in. So our data model is of course, based on a database, and literally everything is represented in the database as its own object type, its own item. So if you look at this one here, this is what we would call a document. It's of course an item in the database, but if you look through that, it has a purpose, scope, definitions, all these sort of sections that are here, which are in their own right also items in the database, right? And if you have a section like this purpose one here, you can simply click here, make some changes or additions. Yeah, so you can simply work in these sort of, try to avoid spelling mistakes, but I can't promise that I'll be very successful, right? But you can work in these sections, with these items directly with in this web-based environment, and you can of course change the layout here. What people generally do is they create the document set that they need based on their SOPs, and they'll become part of the Compass template. We are using templates a lot. You can create documents, additional documents based on the templates that the customers might have. You can also create brand new projects based on templates. That is very popular because if people make a syringe again after they made syringes for the last 20 years, there's a good chance that many of the requirements and tests even, and probably risks, are the same or very, very similar, right? So you can generate new projects based on project templates, and you have a running start with stuff that's already there. But once they start filling in these documents, here's a section that is somewhat special. And you see here, this is now having some design inputs right here. This is where you sort of zoom into the microcosmos of the requirements. And how people generally work in these is very similar to Word. They might say, there's a new input. Let me just check what I wanted to write here. They might have an audible alarm. Yeah, and they create a new item right here. Okay, audible alarm. And they might fill in more data about this. For instance, there might be an acceptance criteria, should bell be louder than 90 decibels. Yeah, so you can sort of create this item and you can then fill it with data. And this is a general way of how people work. They just fill these sort of documents in. And what Dale was saying is, at the push of a button, we can now create a PDF or a Word version of this. And I have a button right here. So if I just generate a document from this, just has to export it real quick. There we go. I put it into my downloads and save it. And just to show you, here it is. And this is now our document that we just generated, right? It has a cover page. It might have headers and footers. In this case, I don't have a header, but I have a footer here. It creates a table of contents. And based on the work we did, you see here, we made some changes or additions right here. We did that. We also created new requirements, and here were the requirements that were there already. So people generally work in this database environment, in this document, for example, fill it in, and then the document can be exported. Of course, you don't need to just take the raw data here. What these documents provide also is a way to review them. So you can do reviews right here. I'm not going into that because that takes a little while. I'm happy to show it another time maybe, but you can also submit it directly for approval and approve and lock these documents, but also the data that's in them, right? So you have a full control over the bucket, which is the document here, and also the sub items or these little items like the requirements that are part of that.
Ansgar, how do you track changes? I mean, you have a big project, a lot of design inputs, and yeah. Now I want to see what somebody has done.
Yes, so I show you this one here to start with. We show and we track modification on each item. So in this case, I make the audible alarm, and you see here that it tracks the changes that have been made here, right? And we don't have a report like this out of the box, but you could generate a report that says, show me everything between these two different versions of the project or the document, for example. Yeah, generally people look when we talk about the documents, and I don't have a good example here right now, but the documents themselves have a history, of course, and you would be able to see all the changes that happen to this document between different versions. You can have a differencing tool here that shows you all the differences between versions of a document, for example, right? Because I haven't prepared this, I cannot demo this, but I could show you that in a proper demo.
Right, but you could see it did pull in at the document level the changes that he had made for the audible alarm.
Correct. And then you can see these changes, for instance, in line, you would be able to see a document sorry, I have to sort of describe it verbally right now, but you would be able to see the differences in line within the document with additions in green and deletions in red and this sort of thing, or you could compare them side by side as well. This is both possible. Okay. All right. So you saw already here, I have changed the view slightly. You know, the default view is the one that we would export as the submission document, but there's working views as well, like this one here, where we show a bit more information about these requirements. And so let me just change to the one here that is in green. And if I open this, you have different options here. It shows you modifications. I showed you this. But for example, you can trace to a higher level directly from here to a lower level. You might want to model interactions between requirements. That is sort of based on the Six Sigma methodology, where if you optimize one requirement, that might have a positive or negative effect on another one. So we can model these. You can generate or link to test methods right here, failure modes and so on. But I want to just show you the trace to the higher level. And you see this one here, this requirement here, is already tracing to a user need in light blue. The reason why I highlighted this is I want to show you, first of all, a more formal trace. Here's a design trace matrix. So if I click to this, on this, you see this is the user need number 18, the one that I highlighted in blue. And currently this one traces only to this particular user need, the one in green. The formal traces are updated constantly based on whatever work you do in your environment. So in this case, I'm going to the next requirement down here, and you see here I can also link it to a high-level requirement. So in this case, I want to link it also to number 18, which is this one here, which is exactly the same that we used for the other requirement. This reuse idea is very big for us, okay? And I don't know whether you saw that when I click on this button here, it shows me a whole bunch of requirements that are currently in the system, right? So you see here the user needs, and it takes these, the user needs particularly, it takes these from the user needs area right here. Yeah, so we have a user needs.
Each user, or is that a list of items for the world, or is it for this user?
This is for the whole project. So any user who is in the role of a designer, basically working in the design space, can link requirements to each other. Yeah, so this is available to everybody. We do, however, I might know where you're going with this. We have libraries, for instance, for hazards and harms, as an example, that are above the projects, and they can be used by any project. Yeah, and we're this library use. And the idea of reuse from libraries is very big with us. And I think Dale talked briefly about the reuse of components. That is something we will go to in the future, where you can reuse whole items and reuse them in your project with everything that comes with it, also from libraries. And when I show you the risk a little later, I can briefly show you how the libraries work. It's really like just a picker that looks into a standard library that is managed centrally. But in this case, you know, these requirements are coming from here. And so if I added another user need, for instance, here, and I'll just say device should be very attractive. I'm adding this into the document that is the user needs document. It's right here. If I go back to my design inputs, and remember I added this requirement already here, but if I select the parent requirement and just search for attractive, it's now here, right? So these pickers are dynamic. You know, they look into the database at any given time, and any changes and any additions that are made elsewhere will be reflected here, and you can then start using these components immediately, right? So there's reuse on this small scale with stuff that happens right here, but also reuse from libraries if you want to. And I'm showing you all this because if I go back to my design trace matrix and I'm going back to my requirement that are highlighted here, the user need rather, that was that are highlighted in blue here, you see now that this trace matrix updated automatically, because initially it had only this link, but now it also has a link to design input 14. Yeah, so these traces can become very large. We know that we have some customers, they told us that they have like one person working on a big trace like this for 6 weeks, and they are still not certain that it's accurate, because after 6 weeks things might have changed, and they are not 100% certain that the trace is up to date. Yeah, of course, this was a very, very large trace, but you see the complexity and how quickly it sort of gets overwhelming if you have, like, let's say 100,000 requirements or so, and they all need to trace with tests and each other. Right. So let me just zoom in, because that was another thing that I mentioned before. We have the bucket here with the document that we want to export. But of course, you can zoom into an item like this one here. So if I just click on it, I go directly to this item in the database. And you see that you have a lot of options here. I go straight into the trace view that Dale also showed you earlier. And this is a live trace. You know, this is an alternative trace view, if you like, from the official deliverable that you have here with the trace matrix. But this one is this trace is up to date as well, just as much as the other one. And you see here it now reflects that you're linking to user need number 18, this one that was in blue. It also links or shows the link to the new user need that I just created. Yeah, it shows you that it's satisfied by some lower level design outputs, but it also shows you that it's part of a design of a test protocol right here. And the reason why I wanted to show you the test protocol is, if I just open this, so there's a test protocol right here. And the requirement that this one is picking up is here. So there's a test in the protocol that is called alarm test. It has a certain number of steps, and it's testing these two requirements. There's requirement 14. The handheld device shall produce an alert when the transmitter battery has 12% charge, and the acceptance criteria is also 12% right here. The reason why I show you this is when I move this out of the way, and I say I make a change to this requirement here. I might say here, it's not 12%, but maybe I say 15%. And I change it in both places, here and here. Yeah, in the name of the requirement and the acceptance criteria. If I go back to my test protocol and I just need to refresh this because it's, you know, it has been called just a minute ago and it needs just to refresh the view. If I go back to my requirement, you'll see here that this has changed here and here. Yeah, the point being that we have a single point of truth. We have this requirement one time in the database, and we reuse it now in this test protocol. And if I make a change here, as long as the changes are allowed, of course, because it might get locked based on all the workflows and the processes we have. But if I make a change, this change is automatically reflected here in the test protocol. So you don't need to worry about these updates.
Can I quickly ask a question?
Absolutely, yes.
And I apologize, I had to log off for a minute. So if you already said it, I apologize. Do you change once the document is approved? Is there a change history that you can see? So version 1 versus version 2? Okay.
Yes, yes,
Great.
you can. There was a question earlier. It was a little too much to show in this demo, but this is the sort of stuff we can show in a larger demo when we have a bit more time.
Okay,
Yeah.
this looks really great. I'm really excited about it. I just wanted to be sure. Thank you.
Yeah, no problem.
I've got another question if I may ask.
Absolutely.
So being that this is web-based, have you guys had any consideration to integrating some sort of guidance systems as you're going through these documentation? Like maybe integrating some sort of AI to maybe help with trying to guide what is right or within regulation as you are making these requirements, as you're going through these design, as you're defining design parameters and making in regulation, so that even if you have some certain designer going through, they may not be completely versed in what the regulatory processes may be. And so just maybe as kind of like barriers and rails for your team as you move forward.
Yes. So we don't have an AI in here right now. And I believe the correct answer for us would be to link to something that's already there. I don't think we would reinvent the wheel, but we would reuse something that's already there.
Yeah.
And I think what you described there is a very tempting thing. Help people, for instance, formulate good requirements, because there's rules around how you write a good requirement. I can see that would work quite nicely. At the moment, we don't have anything, but there's a discussion internally about this.
Yeah, it's a beautiful template to integrate that into. Yeah.
Yes.
Yeah,
Let me just show you one. Sorry.
What I wanted to say in the past year, we've also been having discussions more on the, you know, the complaint side and so on, to maybe like for the device you're doing, what are the possible things you might need to be concerned about with your device, and make having some kind of AI connection to that would give you the things you need to consider.
Yeah,
absolutely.
Can I move on to Amir's question? It's because I think Amir is referring to, you make a new product and you have some guidance, but now you have a standing product and there's a slight change or addition or whatever.
Mm-hmm.
And you only have to change small parts of your whole documentation, but you don't know which parts, because when you have a new product, you go through all the regulations, all the standards, everything. But for the small parts, you don't want to do that. You don't want to have the 12 pages checklist. You only want to have the parts that are interesting for you. And maybe an AI guiding you to where the interesting parts would be very helpful.
Absolutely, yeah. I think the whole it sort of goes, for me at least, into the area of impact analysis, where you say we know we need to make some changes, but we need to understand what impacts that will have, and then I will definitely help with this sort of stuff.
Yeah, because all of the connections are there.
Yes.
And you can follow them in what's there today, but automating that to just give you a better, report that shows all of the places without kind of navigating around them is something we're looking into.
Yeah, I mean that's talk about saving time and
exactly.
being efficient.
Yeah.
Yeah. Your traceability matrix is very charming. It's very helpful. But if you have something new, you don't know which part of it, you know which part of the current matrix is affected, but not what should be added.
Yeah.
Yeah. So can I ask a question?
Sure.
What database is this platform use?
So I give that to Dale. There's we are in the process of getting on a different platform. I think that's fair to say, right? But Dale.
Yeah, so right now we're on an object database, and that object database maps really well into our data schema that we have. We are looking at the potential of other databases that might be more ones that people are familiar with, or some of the SQL databases out there. So, but right now it's on an object database that runs on the server.
Okay, thank you. Because it's more of like text-based database. It's not just a lot of text inside of your data set. So
yeah, so the one advantage of the database we have is because the text length is very variable.
Right.
So it doesn't have any extra overhead, no matter whether it's a small piece of text or a large piece of text. So it makes it very easy to manipulate that data. But most of even the SQL databases these days have solved that problem, because you don't want to have that fixed text size.
Right, because I think it's wonderful to have a platform to build all those information, but I think the search part will be what I will be most interested, because like when you have to go back, look for something, if your search portion is not as robust, then it will make it a little difficult to use. Does that make sense?
Yeah, we do have a general search thing, and that search, if you go to a project, it basically will search everything in the project by default. So it'll look in your documents, look in your requirements, look in your risks. So it'll find everywhere something's is used inside that project. But we offer a lot of more advanced options of, hey, if I just want to find a requirement with this text in this item, you can also narrow it down that way. The other thing that we've done in the past, we don't have this in Compass right now, but is to do more of a full document level search, kind of, so you have an index search and be able to just get to all the documents that made use of something.
Thank you. Very good. Thank you.
Okay. Right. There's really only one more thing I want to show, and then we run out of time. So you see the trace matrix here of this particular, with my mouse, of this requirement here, number 14 in yellow. There's all sorts of stuff. I showed you the protocol, but there's one thing here where we do the link or create the link between the risk world and the requirements world. Really, there's two connections. You know, this requirement might be affected by a failure mode, which then eventually might turn into a harm, right? So, or cause a harm. We don't have a failure mode affected here. I'm not going into an FMEA for this, but I want to show you that this requirement is used as the risk control measure and the risk control measure is called alarm when battery is at 10% charge. If I click on this, I change the view here, and I can see that this risk control measure actually controls these two risk entries in the risk analysis. So let me just go to the risk analysis so that you see how that looks. Here we go. We just open this, right? And this is really, really high level now, right? We have a lot of interactions between our use error analysis, the different FMEAs, DFMEA. We do have a device FMEA. We have a side effects analyses, all this sort of stuff. And they all can contribute to a risk analysis. An FMEA is not a risk tool, and according to the standard, it's a reliability tool, but it can contribute to a risk analysis. So following the standard, in this case, we have a hazardous situation right here with a P1. This is now where the libraries come in, because hazards come directly from a library that is centrally managed by the risk team, by the risk manager or so. And you can select one or several of these hazards. The same is true for the harms. You can select harms again from a library. And if you select a harm, it comes with a severity. You cannot really alter this. It comes from the library. It's signed off, and when you use this harm, it will come with this severity. You can then define the P2, that the hazard leads to the harm. You have an overall probability that is based on a risk management plan that is in the system, that is yours, that you sign off. But I want to show you the risk control, because our design input 14 is right here, and it's implementing this here when the alarm when the battery is less than 10% charge. You might remember that we changed the requirement to 15% charge, and it's of course reflecting that right here. And you can select other requirements, additional requirements that might implement this. So this button here is showing us a picker again with all design inputs and outputs that are potential candidates to implement this particular risk control measure. Yeah. And once this is implemented, you have a residual P1 and P2 and a residual overall P, and then you can see the residual risk here. That is really, really fast and really high level, and I spoke very fast as well, so I hope it gives you an indication that we do a risk management here as well, but there's many, many different facets. And the very, very last thing I want to show you is we don't have a built-in AI, I'm afraid, but what we do have is built-in work instructions for all these different areas. So in this case, there's the work instructions for the risk workspace, and it will give you guidance how you use this tool here. And these work instructions are not only here, I have a sort of a risk area right here, but of course you have deliverables in the risk management area. So if I go right here and I show you our risk, product risk analysis, it's this one here that has all these risk assessments that it shows, including the risk analysis that I just showed you. But of course, these documents also come with work instructions. And if you deviate from the format that we have, this is also accessible as a library by the users. So they might have their own additions to the work instructions or their own updates, so that the work instructions reflect the way our users work. And that's where I leave it, because it's now 5 o'clock my time.
By something you said in passing, that you don't have AI, and I'm thinking, yet, are you actively working on integrating AI into your systems? I'll leave that for Dan.
Yeah, so we've definitely been talking to multiple outside applications that are AI based to see how we can integrate those into our environment. And the biggest, the most of that's been more again around the post-market stuff right now. But this next one we've been discussing is the one that Ansgar talked about, which is really some AI applications out there that help you write better requirements.
I'm thinking you'll need an outside group to help you with that.
Absolutely. We don't want to implement that ourselves. We want somebody that's already crossed that bridge to integrate
Right.
with for those kinds of things.
I'm not looking for an absolute number, of course, in this question, but from a budgeting perspective, how big a commitment do you need to set aside from your working budget to make that a reality? Is that, part of your marketing costs and it's 10% of what you spend on marketing, or is it 50%, or is it like a capital raise or something? I don't know. How big is
To get
is
to
this
the
thing?
AI piece, you mean?
Yeah.
Oh, it's definitely not anywhere near the bigger arrays. I mean, because our integration capabilities are pretty flexible. And so I think if we find the right, application to integrate, our effort to integrate is pretty small on our side.
Well, I think we've amply demonstrated today that we're your kind of people, based on the number and caliber of the questions that we got today. So thank you, everyone.